Hi, everyone, and thank you very much for your interest in the topic. My name is Harangozo. I'm the Wikipedian-in-Residence at the NIHR Coordinating Center. I'll tell you all about what this role means. You also see on the screen Brandon Deeney, who's a science writer for the NIHR Coordinating Center. He's working on the NIHR evidence website to write, plain English, easy to read summaries of NIHR funded research. And he also works with me on Wikipedia articles, and he's going to help us handle the questions you're hopefully going to ask in the session. So as you can see, we're using this Q&A mode of Zoom. There's a Q&A box where you can ask questions. Feel free to ask anything that comes to your mind during the presentation as well. And in the end, we will see if it's already been answered or we'll talk about it. So just feel free really to use that box to ask anything that comes to your mind. I'll share my screen. That's the best start. Yes. And full screen should be working. Perfect. So again, thank you for coming. I know that the topic or Wikipedia as a website does connote some kind of anxieties and preconceptions in people, and that is totally fine. And I'll hope I can address these during my presentation, but these are totally normal. How it's going to be structured is really from the beginning just to explain what Wikipedia is, how it works, then how it's important for sharing health and care research and the audience that uses it for this kind of information. Then I'll show you what we've been doing with NIHR on Wikipedia for more than a year now. And then in the end, I'll try to offer you some kind of possibilities to collaborate with us on this project, and then hopefully we'll have time to talk about any kind of ideas or questions that remain. So, but let's really start from the beginning. What is Wikipedia? Wikipedia is an encyclopedia, and this is important as a genre, so to speak. What this means is that it summarizes already published high quality sources, and it does this in an accessible way for a wide audience to read. So it's not for a professional audience. Of course, it does go into detail, as we'll see later, but it tries to serve information in a plain English language. I think this is part of the anxiety around Wikipedia, that all people will use it for their PhD as the main source. According to its self-definition, and Wikipedia is really trying to emphasize this, it's meant to be a starting point for learning about a topic, about an issue, and then you can use the links it provides to further reliable sources. At the same time, I think it's important to be realistic that for a large number of people, Wikipedia is still gonna be the first and only place where they go for information. So as you'll see, this is why it's very important what we find there. Wikipedia is run by a non-profit foundation called the Wikimedia Foundation. They only rely on grants and crowdsourcing from people. There are no ads on Wikipedia, and of course, as you probably know, it is free to use. Also, the text or images, anything that you find on Wikipedia is free to reuse in any other further context. Of course, you're asked to cite where that information comes from. Again, we'll talk more about this, but this is also something that perhaps makes people worry about Wikipedia, but it is true that Wikipedia can be edited by anyone. You don't even need to register. You can just change what's in Wikipedia, but bear with me, we'll see that it's still not that simple. We're going to be talking about the English Wikipedia, but it's important to remember that there are Wikipedias in more than 300 languages, which not only have their own content, but of course translate content from each other. And I think this is especially important, for example, in global health, but also any kind of information that we add is often, universal in its application. So I think it's an interesting thing to think beyond the English Wikipedia as well. But we'll be talking about the English Wikipedia, which is the largest of the Wikipedias. There are around 6 million articles currently on the English Wikipedia. These receive 10 billion page views each month. So people look at Wikipedia 10 billion times every month. Last year, it was around this. So this comes to more than 100 billion page views. Of course, people do look at Wikipedia from multiple devices, so the actual number of people is somewhat less, let's say around 800 million, but that is in a month. So you can see that it is among really one of the most visited websites on the internet. English Wikipedia, you can see that the audience comes from the USA, the UK, but of course, India, Canada, and many other countries whose native language Wikipedia might be less detailed. Go to English Wikipedia for information. So from our point of view, healthcare, medical care articles on Wikipedia, this doesn't include the care articles. This is only the medical articles. And it shows on English Wikipedia how many people each month go to Wikipedia to read about medicine. So each month, almost 200 million people go to English Wikipedia and check health and medical articles. When we talk about medical articles in Wikipedia, we're talking about English Wikipedia, roughly 50,000 articles that are relevant to us. As you can see, in a year, these get nearly 2 billion page views from all around the world. This is from 2021, but the number is largely the same last year as well. When we think about the audience of Wikipedia who read Wikipedia for health information, it is mostly a general lay audience, of course, and this is what we need to keep in mind when we're going to be talking about what to contribute to Wikipedia. But it's important to know that 50 to 70% of medical professionals use it, and this number comes from the UK, and also it is one of the main resources for medical students as well. So it's not only a lay audience that uses Wikipedia for this kind of information. Medical articles on Wikipedia are somewhat higher quality than articles in general. This is partly because there is a group of editors called the Wiki Project Medicine. They're editors who are mostly medical professionals, and what they do is they're assessing the quality of medical articles on Wikipedia, monitoring any kind of changes, and of course, step in if there's any kind of negative change or something that needs to be removed. And of course, they work on improving the quality of these articles. Bit old data from 2019, but again, it shows quite well how Wikipedia is a very important source for health information. Again, even if it's meant to be a starting point to learn about a health issue, medical topic, for a large number of people, it is going to be, the only place where they go and check for information. Just to further this point of how important Wikipedia is for medical information, what you can see here is the daily page use for the article on monkeypox. Obviously, from the time period that the current outbreak happened. Obviously, the article existed before, but you can really see how a large number of people immediately went to Wikipedia when the outbreak happened, and they went there to find out what this whole thing is about. And you can see the same kind of graph or curve on the coronavirus article. You can actually see the different waves of the pandemic and how people went to Wikipedia to get information. So as I mentioned, it's true that Wikipedia can be edited by anyone, but that doesn't mean that you can just go and do anything on Wikipedia, that you can add anything. There are actually very rigorous policies around editing, and I'll show you the most important ones that are meant to keep Wikipedia reliable. And just because I remembered, again, feel free to use the Q&A box to, put in any ideas, questions that you have, and we'll get back to them in the end. So, policies in Wikipedia to make sure that the articles stay reliable. First one is called a neutral point of view, because this is an encyclopedia, so editors are asked to write in a factual, neutral tone. It is not about your feelings, it is not a literary description of a topic, but really summarizing the facts from a neutral point of view. Perhaps the most important from our point of view is verifiability, which means that anything that you put on Wikipedia, any statement, any sentence, any paragraph, you need to provide your sources. You need to provide links, references to reliable sources so that other editors and readers can check where this information comes from, and of course they can read more about it. Reliable source might sound a bit vague, but there are detailed descriptions on Wikipedia what counts as reliable, and from our point of view, of course, it's peer-reviewed indexed journals, academic textbooks, health technology assessments, and so on. So it is not just anything. And the third policy is called no original research, which might sound a bit misleading for us. What it wants to mean is that Wikipedia is not the place for your personal interpretation of sources of facts. Originally, I think this was created to kind of ask people not to include their unique views on the world, sometimes also known as conspiracy theories or pseudoscience. Don't interpret, but just summarize what others have written, what others have published. As you'll see, I'll mention in a bit, it does also affect what we can do on Wikipedia, because you'll see, I'll get back to this point in a few slides. Actually, this is the slide. So there are limitations for us, or for medical and care researchers, what we can do on Wikipedia. I hope it's starting to sound positive. This is the kind of the negative part, that we can't just go to Wikipedia and add anything. There are, again, policies that ask us some things. So Wikipedia, the medical part of Wikipedia, is asking us when we're adding content to Wikipedia, and you'll see how that looks like in a bit, that we can only use secondary sources, literature, systematic reviews, meta-analyses, academic textbooks, and they're asking us not to base our contributions on primary sources. So, for example, a single clinical trial. Obviously, this is because a systematic review is kind of seen as the current snapshot of knowledge on the topic. whereas a clinical trial, primary research can be something that just is starting to explore a topic. The weight of its findings are not clear. It might be refuted. There might be another clinical trial that adds important detail to this. And this is where we come back to this no original research or no interpretation, is that primary research we cannot interpret. So even if we would know the weight, how important this research, especially if it's ours, we are asked not to interpret it. And in secondary research, this is already done for us because it interprets a bunch of research articles. Of course, again, just to really not to be too negative, this doesn't mean that there's no way, if there's really important primary research, that we can't use it. There is a room where there's flexibility on Wikipedia. For example, we can describe future or ongoing research directions. But of course, if we can make the point that this research is just so important and so unique and important and well established, then we can include it in Wikipedia articles. Before we'll get to show you how or what the NIHR is doing it on Wikipedia, this is really just a few things showing how Wikipedia, besides the policies, is trying to make sure that the content on Wikipedia is reliable. So for example, there are user access levels, which means that if an article is very popular, very current, for example, COVID, then what they do, or editors do often, is that they limit who can edit that article. Because coronavirus, it would be an article that many people want to edit. They're going to say that only people who have been registered for 30 days can edit it, or only people who have already had 500 edits can edit it, so that they this protects Wikipedia from the very obvious, spamming, vandalism, or misinformation. They can also lock articles, which again is a way of limiting who can edit it, and they can completely lock articles if there's some really ongoing attack on an article. This doesn't really happen, but yeah. So it's not necessarily true for all articles that everyone can edit it at all the time. So if there is really a contentious area, then they do implement some limitations. There's something called the watch list, which means that if you put an article in your watch list, you get a notification if a single letter or anything is changed. For example, the COVID article is in the watch list of thousands of editors. So they immediately get a notification if something is changed, and this makes it very fast so that they can step in if necessary to check what has been changed or remove any kind of bad faith editing, as it's called. But there are also automated systems, bots, that remove the very obvious kind of vandalism. But in general, this kind of community editing model of Wikipedia seems to be working in the sense of producing high quality articles. And actually, if I don't forget, I'll send you or I'll put it in the chat. There is really years of academic research into the quality of Wikipedia articles, specifically also health and medical articles, and it does compare with other academic resources in terms of reliability. This is just to show another very important or core aspect of Wikipedia, is that it's radically transparent. So this is the editing history of the 2022 monkeypox outbreak article. But you can have this editing history. You can check the editing history for all articles. You can see who edited it, when, what they changed, compare it to previous versions. So this in part helps editors to find any kind of negative edits, but also, even though the articles are of a collaborative nature, it does, allow for some authorship, because we can see what part of the text has been written by whom. So I am a Wikipedian in residence, but what does this mean? Originally, this role started out in cultural institutions, museums, archives, libraries, because they wanted to share the cultural heritage that they keep or protect through Wikipedia. But the problem was that Wikipedia has a policy called conflict of interest, which means that if you have a conflict of interest with the topic, you're asked not to edit it. This is really so that, I don't know, Coca-Cola doesn't edit the Coca-Cola article saying that it's the healthiest drink in the world, or someone working for Coca-Cola. But obviously, they wanted research and culture institutions, not to be a victim of this policy. So basically, this role is kind of a facilitator between the two worlds, between the worlds of Wikipedia and the host institution, and helps the institution contribute with their research or heritage to Wikipedia articles. What you can see here are the institutions that have or had a Wikipedian in residence. These are only from the UK, but in the USA, there are also plenty, and in other European countries as well. Furthermore, Cochrane for years had a Wikipedian in residence. I think now they have it as a permanent role called the Wikipedia consultant. And they were really for years working on adding their systematic reviews to Wikipedia. And they've been really doing great work. And as you can see, it also resulted in a large number of people going to their library to the articles. But they also made, of course, Wikipedia a lot better. So I've been talking a lot about about adding things to Wikipedia, or contributing to Wikipedia. So basically what it means at the lowest level is to summarize the findings of a study and integrate it to the text of a Wikipedia article, hopefully in a plain English way. So you can see an example here. What's in this bracketed part is what is based on an NIHR funded article. And here is a further example. The numbers that you see after the sentences are the references that point to the original articles and also to the evidence website in these cases. These are further examples just to show you that both of these are based on the same article. This was a study looking at British Pakistani women having difficulties with accessing breast cancer screening in the UK because of cultural differences or language differences, etc. And what it shows is that this single study can feed into multiple Wikipedia articles. Obviously, it is in the breast cancer screening article, but some readers might come from checking the British Pakistani article, the language barrier article. So a single study can really feed into a larger part of Wikipedia. Yes, this is the cancer screening article. This is just an example of a larger contribution. So this article didn't have any kind of information on attendance to screening. So created a new section, and this is all based on NIHR funded research, and the mentioned British Pakistani research is also in this. So this is what it means when I just say, I don't know, editing Wikipedia or adding research to Wikipedia is really improving the articles with based on a study or based on our current knowledge. But another thing that we do in the residency is that we're organizing workshops. These are 2-hour-long events where we're focusing on a specific topic. What you see on the screen was a workshop on multiple long-term conditions, also known as multimorbidity, which is a strategical focus of the NIHR. And we invite a range of researchers who work with this topic. And for 2 hours, we focus on really reworking, updating, improving that specific article on Wikipedia. I'll just show you the before and after of what we achieved in this workshop. I think we had around 12 or 15 participants in this workshop. So this is how the article on multimorbidity looked like before the workshop. As you can see, it was relatively short, unstructured, and more important, all the references that are here at the bottom and the text is based on were more than 5-10 years old. And it was really missing a lot of, for example, NIHR research, but any kind of really detailed description as well. So after the 2-hour workshop, how it looked like is this. Really just going through it fast. Maybe you know that the preferred terminology by the NIHR is multiple long-term conditions. So now that is mentioned, there's a proper definition describing its difference from comorbidity, describing the different naming, different names for it, and proper description of all or a lot of aspects of the topic. And of course, a lot of this research is from NIHR's research, but of course we used also non-NIHR funded research where we needed to describe something. What might be interesting or important is that after our workshop, others have already improved the article, so they built on what we did and expanded it further. And also, I was very happy to see, I think months after the workshop, that the whole article was translated to Arabic. So on Arabic Wikipedia, it is basically based on the text that his workshop has produced. Anyway, so this is just an example. We had further workshops on antimicrobial resistance, telepsychiatry with the mental health policy research unit of NIHR, dermatitis, healthcare quality. So really a diverse range of topics. And of course, it's not only healthcare, but care, social care that we're also working with. Before I go to this last slide, and then we'll have time to discuss your questions. I know that sometimes, so yeah, I do sound like a kind of a Wikipedia salesman, and I don't mean to show Wikipedia as something being perfect. What I try to show is that it is reliable. Wikipedia is really a place which manages to stay free of misinformation. But this doesn't mean that the articles are perfect. And this is also where you come in, that there is a lot to work on, a lot to contribute. For example, medical articles in Wikipedia are very America focused. Sometimes it is explicit in the sense that an article only talks about something in America, but sometimes it's not even said. It's just you realize from the text that this all comes from American institutions and American sources. This is really not to portray it as some kind of a race between the nations or anything else, but really a lot of research from the UK and UK perspectives, for example, on healthcare or institutions or care homes, etc., is missing from Wikipedia. Another thing is that even if the articles are of reliable quality, they're missing a lot of research from the past years. They're not up to date. And also, even though they're supposed to be for a wide audience. A lot of times they're full of jargon. They're not written in plain English. So really there is a lot to work on Wikipedia, which also means that there is, a lot of impact that we can do on Wikipedia. So for example, the multimorbidity article is something that if you check, you can really see the body of research that the NIHR has conducted to be present there. Also, one last thing, that the care articles on Wikipedia are especially bad. Well, not bad quality, but they're missing a lot. So that is something that we are really looking to collaborate with people to improve. So really just to sum it up, what using Wikipedia for disseminating research can offer, it's a platform that is radically transparent, but also collaborative. So if you contribute in a way, you're not alone, but others can also build and give more detail to your contribution, which is a positive thing. And it doesn't mean that they can just delete your contribution, because there are the mentioned safety mechanisms for this. You can reach a wide audience through Wikipedia, and you can share research where people are actually looking for it. Because if people go to the cancer screening Wikipedia article, it hasn't been just offered to them randomly. They were looking for the topic either on Wikipedia or on Google, where Wikipedia articles rank among the first hits. You can share your research in an accessible way, again, that a wide audience who's not going to read academic journals can access research or evidence. You can quickly update it because it can be edited freely. If there's anything new in an issue, you can very rapidly update the article. It can be translated to other languages. As mentioned, it's important for global health, for example. This is really just to mention the more, practical part of it, that it also is measured in the altmetric score of an article if it's included on Wikipedia as a citation. Also, because many of you also work in universities, there has been a lot done, especially in the States, in working with medical students on editing Wikipedia, teaching them how to edit Wikipedia, and this can offer them really a lot of skills that are important, assessing literature critically, having an impact, a culture of open access, etc. This is really just to mention that this is also an aspect to consider. So with these bad words, but the offer of this workshop is that the NIHR is very happy to work with researchers or research teams or institutions to show how to use Wikipedia, how to edit Wikipedia to disseminate health and care research. We have basically 3 formats what we're offering, and this is really not the best word. Obviously, this is not something that you need to pay for. So this is what we're working with people. So we're offering this kind of webinar because you're here, but maybe you're working with a larger team or a faculty or whatever. So we're really this webinar is something that can be replicated for a team as an introduction to Wikipedia. And usually building on this webinar, we're offering the mentioned workshops, which are 2 hours, and we're really focusing with max 20-30 people to improve a topic on Wikipedia. And this is a way to share your own and others' research on the topic. And of course, well, this is not a format, but a step further is that we're really thinking about and working on integrating Wikipedia editing in kind of the institutional structure, maybe the funding, the dissemination strategy, etc. yes, and I mixed it up. So the third point was actually that at these workshops, I'm not showing how to edit Wikipedia, which is a very easy, straightforward thing, but we decided not to spend time with it. So of course, it's also an option to learn how to edit Wikipedia yourself, and then you don't need me or anyone else to facilitate this project. But we are only doing it for those who are interested, because it's not necessary that everyone in a workshop wants to know. And yeah, the fourth is the more integrated aspect of it. So thank you very much for your attention. We're gonna post in the Q&A box a feedback form. Please do fill it, because it is very useful for us to see how this webinar works. But also, if you want to collaborate with us on using Wikipedia for dissemination, you can. There's a part where you can give us your email, or you can just say that you want us to reach out to you, and then we can follow up with the webinar workshop or whatever. But of course, feel free to contact me via email as well. So thank you very much. I'll stop sharing, and I'm curious to see what has been going on at the same time I've been talking so much.
Thanks so much for that presentation, Adam. I've been keeping tabs on the questions that have been asked in the chat so far. So to start us off, this question was asked by two different people. How can you ensure that there isn't a gender bias or a Western bias in the information presented in a Wikipedia article?
There is, and that is a huge problem. I have no interest in a way of protecting Wikipedia, but Wikipedia itself as a community and the foundation acknowledges this as a problem. And they have a number of initiatives trying to make Wikipedia more diverse. But yeah, the sad thing is that most of Wikipedia is edited by middle-class white males from richer countries. So it's not about how I can make it sure that the articles are not biased, but rather this is why it's extremely important that you or a wider range of people do contribute to Wikipedia and don't keep a distance, and that's how we can make it more diverse. So it's not a case of edits of other people being removed. It's rather just a lack of diversity in the among the editors. But again, I don't want to hide anything. There has also been instances, how to say it the best, of kind of hostile behavior among editors. This is not something that is, very representative, but Wikipedia is not an ideal world. It does reproduce, real society. So there are problems, there are difficulties, but these, I think, organizationally, it's all being handled very well, but it is not far from an ideal place for sure.
So the second question was, how do you choose or prioritize what NIHR research is added to Wikipedia? Is it driven by hot topics or something else?
I myself, I don't. Well, so the themes that we approach is quite random. We're trying to reach out to as many parts of the NIHR as we can. And we discussed this with my line manager, but the topic that we're going to work on, I ask it from the specific team. So there is, for example, a policy research unit, and they're going to have multiple themes that they've been working on, and it's up to them to decide what they think is the most important, or what they think is the worst quality article on Wikipedia. So it's not something that we tell them, it's rather that they choose it.
From just to add to that, from my own point of view, we try and add or alerts that we write on NIHR evidence, and there's not so much a prioritization sometimes, and it's just what fits on the existing Wikipedia page, and it might just be too difficult to fit in otherwise. So that can be a kind of limiting factor as well. So the next question was, someone was asking about the programs about encouraging medical students to add evidence to Wikipedia. And someone was wondering if there was any ongoing projects or opportunities via the NIHR for implementing these courses in the UK.
Yes, in the sense that the NIHR is very interested in working with universities on this, so do contact us. But this is something that we're also learning. So we've been talking to faculties and university teachers, but we don't have a very worked out program for this yet. But we do want to. And also there are instances in the UK where we can look for example, the University of Edinburgh has their own university Wikipedian-in-Residence whom I'm in contact with. But so this is something that, yeah, just contact us and we're open to working on this.
Yeah, this is something that I have also been working with universities across the UK on. We're looking about operationalizing adding our alerts to Wikipedia. So please feel free to reach out to me and Adam if you want to receive updates about that project.
And what I wanted to add to this is that even though in the UK there hasn't been many instances, but this is somehow again very US focused. The US part of Wikipedia produced a lot of documents and guidances on how to implement Wikipedia in a classroom, as an assignment, to translate, to critically assess, or also to think about knowledge production. So there's a lot out there in terms of practice that already happened and documentation.
So the next question is, how do you deal with edit conflicts?
Very interesting question. I think I've been lucky that I didn't get to a real editing conflict. There are procedures on Wikipedia. So there are ways to discuss your conflict with the editor or with anyone who's editing or interested in the specific article, and then you theoretically or hopefully reach a consensus. You can prove your point. I think this is how most of these conflicts are solved. But if a conflict is not solved, then there are further ways of some parts of Wikipedia which help to deal with the conflict. I've never been there, but yeah, it is via or through communication mostly.
A simpler question now, about how long have you been or Wikipedian in residence?
Wow. A Wikipedian residence at the NIHR since December 2021. But I've been at another institution for 3 months before that, but that was a human rights library. And I've been editing Wikipedia for a long time, but NIHR has this program since December 2021 with me.
Perfect. Do you do much work with Wikidata or Wiki Commons? I'm really interested in uploading openly licensed images and diagrams and research. So yeah, I think if you could just intro Wikidata and Wiki Commons to all of us that don't know.
Wow. Really, just in short, Wikipedia is just one of the projects of the Wikimedia Foundation. The mentioned Wikimedia Commons is a photo repository, I think that's what it's called, where anyone can upload photos, infographics, but when they upload it, they agree that they do this under an open license called Creative Commons. So which means that whatever you upload there, anyone can use it for their own purposes. And these images are the ones that are used to illustrate Wikipedia articles, but also they're used in education or in many other places. I mentioned that museums and archives have been had a Wikipedian-in-Residence. For example, they uploaded paintings, old photographs, etc. from their collection to Commons. So it is really a huge photo archive where you can see wonderful things which you are free to use. Wikidata is another sister project of Wikipedia. It's a bit more complex. Basically, it is a database that well, gives the kind of backbone of Wikipedia, kind of structuring it ontologically, how different topics relate to each other. So for example, healthcare quality is an aspect of the healthcare article, which is an aspect of the health. It's quite complex, but in short, this is something that we haven't been exploring in the first year of the residence, but that this is something that I personally really want to work with, and there is openness in the NIHR, for example, in adding data about the research projects and publications, and uploading infographics or any kind of photos that have been done during trials or related to NIHR. So again, in short, yes, please don't contact me. This is something that we want to do in the near future.
Just to mention as well, someone asked in the chat, I was using some NIHR specific chat, but an alert is a plain language summary of an NIHR study that we post on the NIHR evidence website, and a collection is a collection of the alerts that we produce on a particular topic. So sorry for that internal language. So another question is, how do we get informed about or sign up to the specific workshops for the updating Wikipedia page?
Good question, in the sense that NIHR is quite a big entity. So what we've been doing so far is quite random, in the sense of reaching out really separately to everyone we can. So there's no kind of central I don't know, messaging board as of yet. But how you can is that you send me an email, basically saying that you would like to collaborate with us, maybe tell what you work on, like what you research, and then for sure we'll get there, or we're going to actually organize workshop according to these emails that we get.
Perfect. So apart from alt metrics, are there any metrics or indicators that you suggest that could be used to track dissemination of research on the platform?
This is a very interesting thing about Wikipedia, that it's the metrics that you can see are the number of people who read an article. So for example, I can show, or I can say that in the first year of the residency, I edited 761 articles, and these articles have been viewed after the edits more than 30 million times. But the tricky or interesting part is that obviously I can't say that all these page views have been, they've been reading that particular sentence that I've added. So what you can measure is the page views of these articles. Of course, if you have a website like the NIHR Evidence, we're also measuring traffic that comes from Wikipedia through the references, but this is always going to be just a fragment of people. So really the big numbers are the people who read the articles. So this is something that you can point to. And in terms of if you need to show that you've been editing Wikipedia, is what I've showed you, this editing history, where you can see your own contribution that it happened. But yeah, metrics wise, it's a strange beast that you have very big numbers, which are true and amazing, but they apply to the whole topic.
Thanks so much. We just had someone clarify what they meant by editing conflicts. They actually meant when you edit a Wikipedia page all at once, is there conflicts in the article? So I think that's a process thing.
Oh yeah. So that is a practical thing that happened to me once. it's very uncomfortable. That's basically a time when you might be able to lose your work on Wikipedia, because so what it means is that basically in the world, two people at the same time clicked on save on the same article and changed something, and then there's an error, and only one will make it to Wikipedia. Really, just in short, there is a sandbox function on Wikipedia where you can create your edit before editing the actual article, so you can basically save your text before that.
So do you write articles from scratch at all?
It happened. So there are 6 million articles, so it is relatively rare that there's no article on a topic, but it is absolutely possible. So we are free to create new articles. That just means that you need to have more content, more text to begin with than a single paragraph. But we do. Yeah, I think I only created new articles for the NIHR about researchers and maybe also trials about the panoramic coronavirus trial. But yeah, there is a possibility to create new articles, but it's really worth checking Wikipedia, because sometimes it takes a bit of time to find the actual article, because, for example, it's not called multiple long-term conditions, but multimorbidity or whatever. So do check, but otherwise, yes, it is an option.
Perfect. So I guess somewhat related to that, is Wikipedia suitable for highlighting research centers? For example, our global health hub at our university, where we would cite various groups and their research.
I'm sorry, I didn't get the question. Could you?
So is Wikipedia suitable for highlighting research centers? For example, the global health hub at our university, where we would cite various groups and their research.
So we're really trying to avoid using Wikipedia in a, and this is not meant as anything offensive, but in a PR way. So for example, when we're adding research, we are not saying NIHR funded research or produced by NIHR, because that would make the text unreadable, even if we only do it, but then if others do it. So basically how you can showcase your research center is through the references or the citations that you use. At the same time, if your research center is how to say, known, then there's also a possibility that it has its own Wikipedia article. The NIHR has, but this is really secondary. So in the actual articles about medical and care topics, we are not mentioning who conducted the research.
When Wikipedia first began, I seem to recall that subject matter experts were allowed to post informative articles on their specialist subject. Is that now done away with?
I'm not sure about it. What I know, so it's not a thing now. I just don't know that this has been a thing. What I know is that they tried to do an offshoot of Wikipedia where only specialists were allowed to write articles, but it just didn't really work because it didn't have enough content, or people didn't really edit it, so it wasn't open enough. So yeah, of course you're free to edit Wikipedia, but being a professional doesn't give you an extra function or space or credit.
Are the discussion pages still automatically generated for each article?
Yes, so there are discussion pages for every article, and also every editor, where anyone can start a discussion about the topic, or if you have a problem or a question to the editor. So there is, this kind of social aspect to Wikipedia, which is a bit more hidden than the actual articles, but it's there, yeah.
I think you touched on the safety mechanisms a bit in the paper or in the presentation, but if you could just maybe review them. We had a question: how do the safety mechanisms work? Is an edit reviewed before being published?
On English Wikipedia, if you're a new editor, then what happens if you want to edit an article is that, other editors need to review your edits in the beginning. I think I'm not sure how this works, how long it goes. Maybe your first 10, 50 edits that don't go through automatically, but needs to be reviewed. Also, for a long time, if you want to create a new article, that is again something that you can't just do, but it needs to be reviewed by other editors. So this is the kind of the first layer. And then, yeah, basically it is a kind of a structure where, you know, if one edits an article, there are many people looking at the same article, getting a notification about what has been changed. There are the mentioned automatic bots that remove content. There are these specialized editor groups that focus on specific parts of Wikipedia. So there is quite a strong process. It's not, you know, pitch perfect in the sense that things might happen. But what is the practice is that any kind of misinformation gets removed very quickly, and also especially because the articles that are prone to misinformation are also watched by a lot more people. Yeah, if you put in Google academic studies of health information on Wikipedia, then you'll see a long list of research papers on health information on Wikipedia. And one of the papers, for example, looked at the dynamics of editing the COVID-19 article and how it really managed to stay up to date during the pandemic and keep out misinformation. It's very interesting to see how it works.
Thanks for that. During a different seminar I have attended about Wikipedia, we were told about the importance of considering conflicts of interest when editing articles, e.g. you should not reference your own research of colleagues. Is that accurate?
It is accurate. And in a way, this is my role, that I work with you or your team. And, you know, I am the kind of the safeguarding aspect, that I check that your edit, even if it has a conflict of interest, is you know, accurate and you don't misrepresent your research. Also, conflict of interest on Wikipedia doesn't mean that you are not allowed to edit. For example, there's a way to disclose your conflict of interest and say that I'm going to edit this article. I have this conflict of interest. Please, you know, other editors, have a look at, you know, what I did and do change it if it's too subjective or whatever. So it is something that they take seriously, but there are ways to still contribute to Wikipedia, and this is partly my role, so that your knowledge or your research is not lost just because you did it.
Thank you. Do you promote pages you have written or updated to let those interested find it?
Sadly, not yet, but this is just shows that this is a new project for the NIHR. They didn't work with Wikipedia before, so this kind of, we worked in various ways with Wikipedia, but kind of communicating our results have been more internal than outward facing. So for example, this webinar is the first that we really communicated to everyone, and the previous webinars were more focused on teams. But we do intend to in the future communicate when we update an article. We just need to, you know, find a way how to do this on a regular basis.
I think you've just answered this, but just to make it kind of crystal clear, I think someone asked just before you said this, if we want to make an edit to include a reference to findings from an NIHR study, can we send it to you for feedback first?
If you mean the article, then no. If you mean the edit itself, if you want to edit and you would write the text, then of course feel free to send it to me, and I'll work with you. It's just, what I meant by no is that I myself, because I'm not a professional, I'm not able to write, you know, the Wikipedia edits based on all kinds of papers. So this is why we're working with the actual professionals. Otherwise, of course, feel free to email me if you have any kind of ideas on how to do a Wikipedia edit, or you want to do a Wikipedia editing, and I'm happy to help.
I think someone in the chat, just the last question that's been asked, was that, do you want to expand on why primary research is not acceptable to add to Wikipedia and versus secondary, tertiary forms of evidence?
Yes, before I do that, I'm happy to be here as long as there are questions, but I do appreciate that some people need to go. Just please remember to fill in the feedback form, especially if you want to work on Wikipedia with us, but you'll also get it in the email via Eventbrite. This policy of preferring secondary research is not something that has been centrally decided. This, I think, is the product of some years of discussion between the editors who work on the medical part of Wikipedia. I guess it also wants to discourage researchers to use Wikipedia in the way that I just published my paper, and I immediately want to go to Wikipedia and say that this revolutionizes the field. So now, of course, I'm exaggerating, but what it asks of people is to slow down a bit and keep Wikipedia, for facts that are more established, more widely accepted. This is how I think that the reasoning goes against primary research. But as I mentioned, there is flexibility.
I think that's everything from the chat now. So thank you so much, Adam.
Thank you very much. If any questions remaining, feel free to email me, especially if you want to collaborate. We're very happy to expand this work that we're doing. And thank you very much, Brandon, for helping with the webinar. And thank you very much for attending. And I hope you got something out of it. And I really do think that it's important to work with Wikipedia, and it's important that people find accurate and up-to-date information there.
And just before you go, if you want to just remind everyone of your email so they can get in contact with you.
Yes, it's...
Perhaps we'll just share that in the email afterwards with the webinar itself.
We will, but it's also on the screen now,
Great.
theoretically. Thank you very much, everyone.